very good evening to all the participants and the host, and I would like to thank Tao for giving me this opportunity to present my research work in conference. My Which is about it is the levels and sources of stress among nurses working in medical and psychiatric hospital. It's a comparative study, and there's a brief introduction of me over here. I'm Nauman Qamar, and I'm the student of Master of Science in Nursing at Tao. Here is a brief introduction about my research. The present study is carried out to make a comparison about level of stress experienced by nurses in medical and psychiatric hospital. A structured self-report survey was used to collect data on basis of demographic characteristics, perceived stress, and amount of stress caused by work-related stressors. A formal permission for data collection was taken from the superintendent of each hospital that we visited to gather data from. The possible association of overall stress level obtained by SPSS with the different independent variables, and the different independent variables were age, maternal status, work shift type of ward, and educational level using t-test and one sample ANOVA test. Relationship of nursing specialty with perceived stress level was further explored by multiple linear regression analysis. Work-related stress level of psychiatric and non-psychiatric nurses in 5 domains of DCL were also constructed using independent sample t-test. Two-tailed tests were used in all the analysis, and the significance level was set to be 0.05. That was the brief intro. So what was the need of the current study? Stress in nursing profession has been identified issue. Stress influences the physical and psychological health of nurses and also reduces the efficacy. Nursing has been identified as an occupation not only impairs nurse health but also impairs their ability to deliver care to the patients, as quoted here. The current study attempts to discover the association of demographic factors and also of work-related factors toward perceived stresses. Additionally, researcher would attempt to have insight into, this is the main thing, it's finding the comparison of level of research and sources of stress among the nurses working in psychiatric wards and the medical units of the hospitals. Materials and methods. Research design that I used was correlational cross-sectional research design was employed in this study, and the total number of participants in the study was 134 subjects, with 49 nurses from the psychiatric hospital. It was just one hospital, and 85 medical nurses from 3 multidisciplinary hospitals of Lahore. Data collection. A structured self-report survey was used to collect data on basis of demographic characteristics, perceived stress, and amounts of stress caused by work-related stressors. A formal permission for data collection was taken from the superintendent of each hospital. Study subjects were recruited by approaching the nurse manager within the nursing facility and requesting her permission and her assistance in gathering the desired data from the staff members. The individuals conducting the study distributed the questionnaires personally to each willing participant, explaining the purpose of study, motivating and assuring respondents' anonymity and confidentiality. Participation by subjects was kept entirely voluntary, and there was no inclusion or exclusion criteria. Sampling techniques. To summarize the whole story into a very short thing, I used the non-probability sampling method, considering the accessibility of the issues and complexity of the probability technique for selection, to select units, wards, and then sample subjects from respective wards or units in order to make the two samples comparable and homogeneous. Wards units in multidisciplinary hospitals to have extremely low or extremely high stress level were excluded from the study. For example, the wards which are proved to have significantly raised level of stress among nurses compared to other wards in hospitals such as emergency ward, ICU ward, were excluded from the survey. Similarly, the wards with which examinantly low level of stress OPD were also not included in the survey. This was done so that the extremes of the results could be avoided. As a sample of non-psychiatric nurses was taken from general hospital, they belong to very different wards, which include medical wards of different specialties. However, since all in psychiatric hospital were seen not to have any considerable difference in terms of workload, patient flow, staff shortage, and other factors which form basis for stress differences among nurses working in same hospital. Sample was obtained from nurses in all the wards available at the time of the survey. Variables, they were independent variable or also the criterion variable. Criterion variable is stress among psychiatric and non-psychiatric nurses, which is of the very concern. Independent or the predictor variables were socio-demographic variables like nursing specialty, gender, age, marital status, hospital units where employed, qualification, type of shift they are currently working on, years of experience, childbearing status, and husband status of employment. Other work-related factors are patients' demands, organizational and managerial issues, staffing, future concerns, and job satisfaction. Research instrument that I used in the study was a self-report questionnaire. Survey was employed. Research as data collection tool. The questionnaire was designed in 3 sections to suit the purpose of the study, and items of questionnaire were selected based on the literature review. The questionnaire was 3 parts comprising of 54 items. Questionnaire was translated into Urdu by a professional translator. Urdu is our local language over here. Considering the understanding accessibility issues of prospective target population, these include a basic sheet within the first page of the questionnaire following a perceived stress scale and DCL stress scale, which are discussed on the coming slides. Statistical analysis. For statistical analysis, I used SPSS version 17.0 to generate descriptive and inferential stats. Survey was received from the participants immediately coded and assessed. Descriptive statistics, namely frequencies and percentage, were utilized to characteristics, and comparative graphics of 2 groups were made using chi-square test and independent sample t-test. The normality of distribution for continuous variables was evaluated using 2 tests. The possible association of overall stress scale obtained from SPSS, the S is missing over here, with the different independent variables, and the independent variables were age, marital status, work, shift type, ward, and educational level, evaluated using t-test and 1 sample ANOVA. Type of nursing specialty with the perceived stress level was further exposed by multilinear regression analysis. Work-related stress level of psychiatric and non-psychiatric nurses in 5 domains of DCL were also contrasted using independent sample t-test. 2 tests were used in all the analysis, and specialty statistics. The nurses working in the general hospital and medical wards were experiencing significantly higher stress compared to nurses working in a psychiatric hospital. Was 23.45, whereas in the psychiatric it was 17.61, which was significantly less than 0.05. Although medical nurses reflected higher average stress scores, both categories included low to moderate level of stress. Medical and psychiatric nurses for work-related stress and stresses. The 4th major objective of this research was to assess whether intensity of work-related stress differ between psychiatric and medical nurses for aggregated work-related stress, and in different domains of work-related stress individually. DCL stress score was used DV and nursing specialty as IV. A series of t-tests were conducted to compare the different scores of nursing stress. The means and standard deviation of DCL total factor score of two specialties group were reported in the table 4 that I mentioned earlier. No significant difference was found between the two groups on DCL. Total score was 53.78 versus significant difference between psychiatric and medical nurses on the three scores of work-related, namely staff-related issues. Mean score was 10.61 for the medical, and for psychiatric it was 13.44. Further, prospects mean score for the medical was 4.9, and for the psychiatric it was 6.02. Further, prospects means future in the organization. Satisfaction.
Hello.
Yes.
Mr. Nauman.
Yes.
You got another 3 more minutes to complete. Please complete it.
Okay.
You got another 3 more minutes. Continue, please.
All right. Job satisfaction scores were 4.